Hi guys, good evening. This is Dr. Jenny, physical therapist and doctor of physical therapy, certified exercise expert in aging adults, and the current vice chair of the Global Health in Aging Adults in APTA Special Interest Group. All right. So tonight for our Thanks God is Thursday, another innovator, entrepreneur, and a leader will be interviewed. And if you are in United Arab Emirates and Saudi Arabia, salam alaikum guys. And if you are in Philippines, mabuhay Philippines, all right? So maybe that's morning to you. So magandang umaga guys. So it's my pleasure to introduce to you guys Lady Servillas. Lady Servillas is amazing entrepreneur. Why? She's a physical therapist for 19 years and she is the CEO of Home Health Agency, one in South Florida and one in North Florida. So one in South Florida is the Conquest Home Care Plus and the ServCare Home Health Agency in North Florida. So if you are in Florida watching right now, check out those home health agency. She's always in need of physical therapists, occupational therapists, nursing, and also home health aid. She's also the owner of the Medicus Diagnostics. It's a mobile X-ray and ultrasound company. We're really in need of those kinds of mobile technology here, even in Delaware. All right, she is a physical therapist and also masters in different kinds of compliance, also knowledge in marketing. So that's really good. And she did also graduated 2 years ago in nursing. That's why she's able to do all these things and love and passion with the agency, serving adults, serving aging and older adults. All right. So tonight we will get to know her more, and she is also a certified Alzheimer's disease dementia care trainer. So let's get to know Miss Lady Servillas. Thank you so much for this opportunity. How are you?
I'm good. Thank you, Dr. Rosa, for inviting me. Such an honor to be here.
Yes, you are amazing. I'm just checking your highlights. I said, how can she able to do all these things at this young age and with all these wonderful agencies, and what will be the skills that we as therapists needs to be able to manage these kinds of business and improve and be well in entrepreneur level, lady?
I think the topmost secret in being able to multitask is knowing that anything that we do here, to be quite honest, is more on, of course, God's grace. And the second is being able to trust the team that you have. You can't possibly know everything. You rely on other people's strengths and weaknesses at the same time. If they have a weakness, then maybe I can be the strength, and vice versa for others.
Wow, that's really good. How about the training? So can you tell us more as a clinician, your physical therapist before, and when did you come to the point that I want to have a business, and what are the steps and training that you're able to do to
So
have?
I came here in 2002 from Manila, University of the East from Magsaysay, 2002 batch. And then I knew coming here that I always wanted to be in business. I've always been in business. So I figured what's the easiest way is actually, get to know people first. That's super important. And second is staffing. So I started owning a staffing agency. So that's where it all started for me. I was doing skilled nursing facility on top of home health, and then we started knowing more people. So I said, I'm going to start doing staffing agency.
Oh, so it's staffing agency initially, and then, oh, but you're already a therapist before.
Yes.
Wow, wow, that's really good. That's amazing. For us, we just go straight to our company, like employer, go 8 to 5. But you
Yeah.
really focus on, I want to do more. So that's really good. So what training did you do? Like what kind of classes, courses, books that we need to study and learn just to be more skillful?
So I'm a big Yeah, so I'm a big like my leadership skills, if I can say that, is like more on like the book is like the H3, being humble, you hustle, and that's like really one of the keys. And Ken Blanchard is one of an amazing author that talks about being a good leader by being a servant leader. You can't really be a leader if you don't know how to serve people. So I think that's where the passion is coming from, is being able to know that you are serving, the elderly population. Especially for me, that's really where I am, 100% elderly. So that's where my love is.
Correct. Yes, and then because she's also in a passion of serving the aging and older adults, she's doing now the certified exercise expert in aging adults. And also, how do you find it? And also, she did a positive approach to care of of Tipas now. She is one of our experts in dementia field. So tell us more about this wonderful course.
So I just want to tell everybody it's the most useful. Clinically, I felt like I was just coming out of school. Like, oh my God, I did not know this. And because it's all clinically based, evidence based, you will learn so much. Even though you think like you've been a therapist for 20, 30 years, after you attended the CEAA, you'll be like, I did not think of that. I did not think of that. Like literally, it was such an eye opener for me. Like I started every time I come out of a training on a weekend, I literally would apply it in one of our clinics, and it's phenomenal how it actually super works.
Yes, I really enjoyed that too. I did that on last 2015, and I am so grateful that Dr. Jill and also the other team, Dr. Bill Staples and Dr. Kathy Sholek right now is the Jerry APTA, APTA Jerry president. So I was able to also, like what you've said, applied all those things the next day, that you're so excited.
I'm so
And knowing
excited. Yeah.
we are Filipinos. When I first came here, I'm new. You said you're here since when?
2003 actually.
2003. I'm only here
Mhm.
in 2012.
Oh wow.
Yes, only here 2012. I said during my my first job, I said I'm a home house calls. I only know most probably like 5 evidence-based tests. And when I attended, and I keep going courses on top of courses to courses. And then I said, after those things, when I just one course for the CAA, I learned a lot of evidence-based tests. And as if you were surprised only for those short time that you're able to be like an expert. So that's really good. I agree with you. It's an investment. How about
Oh,
Lily,
amazing.
the positive approach to care? What's your feedback, and also what do you call that? Um, I forgot the term. Like the things that you always want to remember and share to others. Something like there's a term for that. Mhm.
Yeah. So what I like love about the Tipas No positive approach care is I've seen it work with others. Actually, there was maybe a couple of years ago, there was a therapist that was, that was doing the PAC, the Tipas No approach. I'm like, that's different. I'm like, and when you see something, when you're passionate about what you do, that you want to see people actually, really get better, you want to like kind of observe more. You want to know what's going on. You want to know what's the next step. I want to do that. I want my dementia patients to actually have quality of life. I don't want anybody telling me like, hey, they're not following instructions, they're done. It's like, no, 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 we're not done. Like that's why we are therapists. We make their life better. So when I saw that, I was like, I'm going to take this in a different level, and I want to be able to train because my heart is about growth with, not just with our company, but with other people more on, like seeing other therapists, like have that passion of seeing a change when you do something and seeing a positive change. So I did the Tipas No, and it's been truly phenomenal. I mean, a lot of the clinicians that we have, a lot of, the student interns have seen it work and like, who is this Tipas No? Yep, 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 that's the one. That approach works. So
That's really, really good. And I learned Tipa Snow. I told her when I speak with her in one of our
Oh
interviews,
my god, that's
Tipa,
amazing.
yeah,
Mm-hmm.
Tipa, I first saw you when I was new here in America. You really look like and act as if you have the dementia.
She does. I swear, I feel like, God, she's
Yeah,
really good. Maybe that's why she really knows it.
yeah, she's in the character. When I did an
Yes.
interview with her a few months ago, like what I'm doing with you right now, she's talking as if she's talking to me. Like try to stand up. And I get up. I thought that she's talking to me, but she's talking
Uh-huh.
the character of that she's talking to a dementia client. So she will just switch here, just like she's talking to you, and switch that she's talking to the patient. So that's really good that she is able to share her knowledge to us. As you said, that you're able to
And
what
I think that's
you
the
have
bottom
rehab
line.
summit. That's really good. Go ahead.
Mm-hmm. No, you did. No, you did amazing with that one. I mean, a hands up. And if there's anything, I think that totally. I was telling Dr. Joseph a while ago, like one thing that actually magnetized me to her success is when I saw that she interviewed Tipa Snow. It's like that is like I am such a fan. So from there on, I'm like I'm gonna follow Dr. Joseph because she's doing something great, and I want to be part of it. So thank you for having me.
Thank you so much, lady. And I was really surprised with when you sent all your highlights. I said, she's so amazed. She's so young. You know, guys, why I keep telling her we have something unique and very common before we met up. We have the same date of birth. We're both November 21. And then we have lots of common. And then we were surprised. That's why we were already connected right now. And it's our first time to see each other like this,
That is
but we're
true.
able to chat only recently. And as a matter of fact, she's also doing a leadership as well in the APTA on the bylaws and reference committee. And also she's the vice chair. I think that's the vice chair. She's on the membership committee on the
Yep. Mhm.
Florida Physical Therapy Association in the geriatric SIG or special interest group. So
Yes.
doing business, doing clinical, and also leadership. So how do you manage all those different hats?
So I just want to clear. So I'm actually like the chair for like for new members for the FPTA Geriatrics. So
Oh,
just want to
okay.
make sure. Yep.
For
Hmm.
the members. Oh, that's why
Yes.
membership committee, but you're the
Membership
chair.
committee. Yeah.
Yes, yes.
Yes.
Because I
Uh-huh.
saw
So
the
yeah, I guess yes, it has to be.
yeah, and I saw the FPTA, APTA, Jerry C is mini. Mini is your
Yes.
chairman, but you're on the
Yes.
membership committee. You're the chair. All right.
Yes. So
So that's
I'm on the
really,
membership committee and I'm part of the APTA committee for the reference and bylaws.
and you're the only Filipino in the reference and bylaws. Tell us more
Yep.
about that. What is the bylaws? What is reference committee? We are just not familiar with all those things. I'm just learning about the House of Delegates. So what is the bylaws and reference committee, lady?
So the bylaws and reference committee. So every year, like every house delegates or every chapter would present, like a law or something that they needed to change or wanted to change. So the reference and bylaw committee were the one, I guess, doing the research on what's correct. Like even like a single dot, like should it be put this way, or like what are the proper words, or what are the things why it couldn't pass or why it should pass. So we're pretty much like the guide in a way. So we're the one checking what we can't do, what we can do. So and then the other house delegates presented, like actually it just happened a couple of days ago over the weekend we did that. And thank you to Miss Linda Ergol, which has been, a phenomenal APTA person herself that trusted me with this kind of, committee. I'm like, I was totally shocked when she asked me, but thank you. So
That's really good. That's really true. If they know people who has really good potential and also voluntary and also the skills, you really need to have the skills and also the learning capability on these kinds of
Yeah.
roles. So thank you for what you're doing, lady. You are amazing.
Oh, thank you.
So in our balance and falls support group, you love aging and older adults. Can you tell us your favorite balance exercise to prevent falls?
So my favorite the favorite balance exercise for me is actually being able to do it truly depends on the, well, of course I'm on the geriatric side of things, so I do a lot of like the CPSIB. So I challenge our, geriatrics on different surfaces, because that's the only way that you really get them out of their, stability. You have to get them out of their stability to be able to, for them to engage their core, for them to actually engage all the muscles that they needed, because they are eventually going to fall. So we have to train them how to fall correctly, and you have to put that in mind every time you do a treatment plan, right?
Yeah, make them fall to prevent fall.
Make them fall. No, teach them how to fall correctly.
Yeah.
Yeah, just make sure you're holding them.
Perturbation, just simple things like that. They're so afraid
Yes.
already, you know. They will keep asking why you need to push me back or why I need to practice
Push on the side.
walking
Yeah.
backward. You know, we
Hmm.
always need to explain to them how important is it, because walking backward, stepping backward is like opening the door. What if somebody what do you call that? That while you're walking, let's say in
Somebody bump into
crowded,
you. Yeah.
yeah,
Mhm.
crowded places, you know. So that's really good. How about in dementia? What is your best, always effective technique? You know how difficult are clients with dementia, and how do you manage people who are really having difficulty, always refusing therapy? So what's your style and technique with dementia?
For me, it's all about. I mean, first is the, of course, the positive approach here, and second is profiling. When I say profiling, it means that you're not just going to go in there and evaluate the patient, because you're not going to get the answer. You're going to get the answer from the patient's family members. You're going to ask, what is Mrs. Smith's favorite color? What did she used to do? Because remember, dementia, they kind of have the long-term memory still intact. So I'm going to incorporate what they used to do, what they used to love in the therapy. On top of that is your go-to is the staff. They know, I mean, if they're living in an assisted living facility or if they're living at home, those are your go-to people. Don't expect to get something out of your dementia patient right away. No, know them, know the history behind who they are exactly, and you're gonna get a reaction out of it. I guarantee you will.
Exactly. I totally agree with that. History taking. I was surprised when you keep telling Mr. Smith and Mrs. Smith. That's also the most famous patient I have, Mr. and Mrs. Smith.
Mr. Smith, yeah.
Yeah, sorry. I was surprised you're using that too. Oh my God, that's another check to the box. We
Oh my
always use that. Yes, I keep telling them to the students that I am speaking with, lecture, educating, always be, I like when you say profiling. So for me, I keep telling them history taking is a must. And always when I check with the care treatment with the dementia clients, I always make a point that the caregiver is present. So I am doing house calls, lady. So I'm home health. So I used to have out assisted living as well, but I am doing home health now. So I always ask the caregiver to be around, because whatever we teach them is temporary only for us, because only Medicare will allow a certain time. But they are the one who will stay for a long time, right? So that's really nice advice as well. So they are really tough. So how can you, what are the messages that you want to tell to our new therapists right now?
The message for the new therapist is clinically your assessment is so important. Don't think that you can, and when you do an assessment, don't think you can get it the first time you saw a patient. Remember, there are times that you got them a good day or a good time. The second day you might not get them the best time, like they're not doing so well. So assessment is key in anything, like, again, it's the base, it's the baseline. So you want to make sure you do a real good assessment. And again, shout out to the CEAA. They taught me how to do it much better than I used to. So that's definitely one thing that I will let the new therapist know, that how important it is, how important you communicate with the family members, that you educate the family members as well. Because at the end of the day, you are passing the baton to them. Because again, you can't be with them the whole time. So
Wonderful. Thank you so much. So I always ask this to all my interview. So what keeps you moving? So physically, and also like what makes you move or goal, your things like that.
I think it's the passion and purpose. Like, I'm passionate about seeing people do better in life, especially our patients, and the purpose of I was put here on earth to actually make a difference. So that's where the passion's coming from.
And keeping you active, do you have any specific diet or exercise that you always do? We have many colleagues doing running,
I
walking.
know.
I am doing.
And you're
How
doing the
about you?
Zumba, so
You're doing Zumba?
I know, between Zumba. Well, I actually, I do some, of course, some Peloton bike. So you can add me, Lady Servillas.
Oh,
Don't judge how slow I am, but you can add me.
wonderful. Thank you so much, lady. So how can we connect with you? You said that you are always hiring for therapist assistants, therapists, PT or OT, and also nursing and home health aides. So how we can connect with you?
So you guys can send me, of course, through Facebook. You can send me a private message, Lady Servillas, or you can send me a text message or give me a call. So it's the my personal number. You can go directly to me and just send me a message, and you can also like email me. I'm sorry. So you can also email me. It's lservillas at wecaretomake-a-difference.com. And I will make sure to get back to you guys right away.
Amazing. Thank you so much, lady. If you have any other closing remarks or message to our listeners for the Balance and Fall Support Group and also for the other groups that we usually share for this, all right, tell us more.
I guess the last words will always be, when you do something, do it 100% and do it always with a passion and a purpose, because that will always direct you the right way. So that's my ending.
I love that. Do your best, 100%. That's really good. That's a good closing remarks. Thank you so much, lady. And we will connect with you. Guys, if you have any questions about how to be successful PT entrepreneur, and imagine she has lots of home care agency, and she's also
Or
doing, oh, what's his name? Is it a girl?
Chewy, Chewy, yeah.
Chewy. Oh,
Chewy's
that's
a
so
boy. It's like, oh,
cute. Say hi, Chewy.
hi,
That's why
Chewy. I'm
she keeps,
sorry.
she keeps waiting for you. That's why, Chewy. All right. So, Chewy, I hope you had a great night and stay with Lady. And guys, thank you so much for watching and listening to us. If you have any question, connect with Lady. We will get to your questions, your inquiries to her directly. And follow us with Fishigen PT and Wellness, and also in Balance and Fall Support Group. Thank you. Bye, Chewy.
Thank
Bye, Lady.
you. Thank you.
Appreciate you. Thank you, guys. Bye for now.